Hello, I'm Vikram from GE Healthcare and I lead the Women's Health Ultrasound for South Asia. This year we are completing a landmark moment. 20 years ago, Voluson joined the GE family and our journey so far has been nothing but exciting. Your clinical expertise along with Voluson innovations have helped to not only set the standards but have raised the bar in delivering unparalleled care for women's health. We are committed to push the boundaries of innovations further to serve you with the excellence you demand. Keeping up with the spirit of innovation and to celebrate your love and support of Voluson for over 2 decades, we at GE are extremely proud to introduce the latest and the most advanced Voluson technology made till date. As someone once said, all good things come in threes. Today we have not 1 or 2, but 3 products to showcase and introduce. Besides the big reveal, our program includes expert talks from leading clinicians. Now it's showtime. Without further ado, let me hand it off to Mr. Ashish Shah, Ultrasound Business Head, GE Healthcare, South Asia.
Hello, this is Ashish Shah and I look after the ultrasound business for GE Healthcare for South Asia. Welcome and thank you for joining us today. Today we have a double celebration on the card and we cannot wait to share it with you. At the outset, we are incredibly grateful to you for showering your love and blessings to our Voluson Ultrasound for the past 20 years. We have heard phrases like, Voluson is ultrasound, ultrasound is Voluson. Your support has made Voluson to be the leading ultrasound brand globally in women's healthcare segment as well as overall ultrasound segment. Voluson is synonymous to groundbreaking innovation. We have consistently tried to evaluate needs of women during their entire life cycle from pre-puberty to menopause to provide clinically relevant technology. It makes us proud and humble that over the last 2 decades we have created some of the biggest technological advancements. Like in first trimester, high-frequency transvaginal probe and HD live silhouette to diagnose structural abnormalities much better. In fetal echo, features like stick, radiant flow and fetal heart quantification help today clinicians to detect anomalies much earlier and to plan surgeries for better outcomes. Sono-AVC follicle, vocal, uterine trace are quite useful in assisted reproductive technology. And I can go on and on and on. All these innovations have been made possible because and only because we listen to your challenges and we create ultrasound solutions that enhance the connection between you and your patients. And we work relentlessly to break new ground and advance innovations. And we do it all with the goal of empowering you to provide the kind of exceptional care that will exponentially improve women's lives and ensure better health for generations to come. Today, as we stand here to celebrate the journey of Voluson for last 20 years, we want to introduce to you our latest solution in premium ultrasound. We believe this new technology will help set you new standards for unrivaled imaging capabilities. Experts like yourself need cutting-edge technology for complex cases while having the flexibility and the comfort to integrate the same into your daily workflow. The wait is over, gentlemen. Welcome to the latest and the most advanced Voluson BT21 Expert Series. Our commitment to keep advancing innovation to help you obtain critical answers, faster answers, which all result in much more conclusive diagnosis. Wow, this is truly path-breaking, isn't it? Let me now take the opportunity to introduce to you Dr. Peter Falkensammer, our Global Product Manager for Voluson Expert Series, to share with you his thoughts on the latest innovations coming in the BT21 series.
Hello everybody, and welcome to this session. My name is Peter Falkensammer, and I'm the Global Product Manager for the Voluson Expert Series at GE Healthcare. And today, I'd like to introduce you to the BT21 release of the Voluson Expert Series, where we're able to bring new innovation, new enhancements, and new functionality to the market. So, when we talk about the Voluson Expert Series, we're talking about the Voluson E10 as our flagship product, where most of our innovation is going to. But our annual breakthroughs don't only affect the Voluson E10. They're always bringing new functionality to the Voluson E8 and the Voluson E6 as well. And as an entire platform, the Voluson Expert Series BT21 really enhances imaging capabilities on all three products. Now, what is the basis for this? And with that, I'd like to take a step back to talk about the Radiance system architecture. The Radiance system architecture is really the core of the Voluson Expert Series. It is the hardware combined with software that we have introduced back in 2015 when we launched this platform. And over the years, we have continuously enhanced this architecture. So as of 2021, we have 6 times more data and double the processing power that this architecture can provide to the user. And how do you see this? Well, you see high resolution images, high frame rates, and with parallel processing, you see high imaging capabilities in 3D. And all of these are, let's say, possible because of the capabilities of the Radiant system architecture. It provides you clarity in the image, for example, for first trimester imaging. It provides you excellent color Doppler sensitivity to visualize blood flow all along the pregnancy and multiple other applications. And it provides sophisticated 3D capabilities so that you are able to visualize and better understand three-dimensional relationships and easier demonstrate those to your colleagues or to patients. And with that, I'd like to take you to the first enhancement that BT21 offers, which is a functionality called shadow reduction. Now, what does this do? Shadow reduction is a functionality that reduces shadow in the image. So it detects areas that are obscured by a bone, for example, and in those obscured areas, it acquires dedicated information by using a low frequency signal, because low frequency typically has better penetration and thus is able to penetrate structures that a high frequency signal cannot penetrate. And so with that combination, you're able to visualize the entire image in a more comprehensive way, which ultimately should give you a better overview and with that a better diagnostic confidence. And you can see a few examples here on the right side of the screen, where you can see highlighted areas that are obscured by either bones at the top or by the lower uterine segment, by the bladder uterus interface, and where shadow reduction really is helpful to visualize anatomic structures that are otherwise hidden. Now, where is this introduced? On all probes that are relevant for obstetric ultrasound. And you see the probes listed here on the left side of the screen. This is where your most used probes for everyday obstetric and gynecology scanning. And with that, really is targeted for you to be able to have more diagnostic confidence and a better anatomic overview in your everyday imaging examination. So what else is new? We have enhanced the functionality of slow flow. And let's summarize what slow flow was. Slow flow is a capability that it's a Doppler capability that is able to visualize low velocity blood flow. So it's a very sensitive technique to look at capillary veins, small vessels, and low velocity blood flow in those vessels. Now, what is new? We have added the 3D capabilities to this. Now that you can acquire those signals in a three-dimensional way. Now, where is this useful? I'm showing you here some examples from the fetal brain, from an ovary, and from a placenta. Any structure where low velocity blood flow is of diagnostic interest. And this is where slow flow 3D can give you a better overview and a better understanding of anatomical relationships. Now, one of the real highlights of BT21 is the support for the RM7C XT Clear volume probe. It's a new probe built on a matrix convex array basis using XT Clear technology. So what is XT Clear technology? XT Clear technology is a single crystal transducer technology with the most sensitive backing material, which ultimately provides in a super high resolution image and capabilities for excellent tissue differentiation. Now, of those customers who have already been using it, we're getting tremendously positive feedback, and everybody who has been using it is actually really excited about this probe. And with this, we're really able to push the imaging capabilities to a new level, not only in 2D with high resolution imaging, excellent tissue differentiation, but also in color Doppler or with 3D, with really best possible imaging capabilities. But with BT21, we also don't only focus on mechanical probes, we're also enhancing electronic probe technology. And I'd like to take a moment to emphasize electronic 4D again. It's a leading technology on the market, leading technology in women's health, which provides you with great image quality based on the radiant system architecture, but with additional workflow enhancements which are unique to electronic 4D, such as biplane imaging, which allows you to visualize two planes simultaneously at the same time, with the possibility to acquire e-stick acquisitions, which is a stick technique, but only with 3 seconds of acquisition, it provides you a full 4D clip of a beating fetal heart. And this not only in grayscale, but also in color Doppler. Or another example where electronic 4D is particularly helpful is VCIA thick slice imaging. In this technique, we're not only acquiring a plane, which is the conventional way of acquiring ultrasound, but it is a thick slice imaging. So we're adding more information to the image, and this is helpful in situations with poor tissue differentiation in hard to scan patients on the one hand, but it's also helpful, for example, to visualize the bones of extremities, because sometimes it can be challenging to align your ultrasound beam exactly with the orientation of the bone, but with using a thick slice, that actually gets substantially easier. Or also electronic 4D capabilities are able to provide you with the highest volume rates on the market, which are typically 2 to 3 times higher than the volume rates of mechanical probes. So giving you a real high resolution, real-time experience of volume imaging. Obstetric and gynecology is our main focus of innovation on the Voluson Expert Series platform. But we're also expanding our functionalities in other areas. And with BT21, we're introducing a shared service high-frequency linear probe with the L8 to 18i. You can see this is a linear hockey stick probe with a very high-frequency crystal, which allows you to see high resolution in the near field for all shared service applications, such as lymph nodes, such as musculoskeletals, such as thyroids. So in several applications where a high frequency signal is important, this is a probe of choice because it allows you to see a lot of detail. Another function that I would like to take you through now is the fetal heart imaging. And a few years ago, we have introduced Fetal HQ. Now, for those of you who are not so familiar with this, what is Fetal HQ? Fetal HQ is a tool that helps you to analyze the fetal heart in a few different ways, and particularly focused on the size, the shape, and the contractility of the fetal heart. And with Fetal HQ, there's essentially 2 ways of analyzing this. The first way is a qualitative approach. So qualitative means visualizing the contractility and this, as well as the size and the shape. And this is what you see in the top of the image. You can appreciate the shape and the size of the ventricle, both in end systole and end diastole, and you can appreciate the contractility by looking at the heartbeat on the left side of the image. But also, there is a possibility for quantitative analysis. And quantitative analysis essentially means measuring. So fetal HQ allows you to measure parameters for all of those aspects, for the size, for the shape, and for the contractility. So for size, for example, we're measuring different diameters in the fetal heart. For shape, a very good parameter is the sphericity index. So comparing the length with the width of the entire heart or a ventricle, and thus giving you a feeling or a number to quantify shape. And we're able to quantify contractility by analyzing fractional shortening parameters as well as strain parameters. Now, what is unique about fetal HQ? The unique aspect of fetal HQ is that those tools and those measurements are specifically designed for fetal use. So you can measure both ventricles simultaneously. You can compare those measurements with normograms, and by doing so determine normal from abnormal contractility or contraction, and it allows you to generate a very comprehensive report which includes all of the relevant parameters, which includes normograms and graphs to illustrate your clinical finding. Now, what is new in fetal HQ? There's two main aspects. One is an autoflip function, because you can acquire a four-chamber view from a breech perspective, so when the fetus is breech or when the fetus is cephalic, right? And in both cases, you can look at the four-chamber view, but it will be flipped. Now, what the autoflip function is doing is that it is actually detecting those by the sequence of the markers that you set, and then it will, as you can see now, just saw now on the screen, it will automatically flip those view for you. The other enhancement of fetal HQ is a quiver function. Now, what does the quiver function do? Is sometimes it can be challenging, as you can see on the right side, it can be challenging to exactly detect the boundary of the ventricle. And this is where just a little bit of movement in the ventricle is beneficial, because it will help you to better see and determine where the edge of the ventricle is. Now, these are the main two enhancements of fetal HQ that we're introducing with BT21, together with some new measurements and some new normograms that will make the assessment of the size, shape, and contractility of the fetal heart more complete and more comprehensive. Now, one other enhancement in BT21 is really around cybersecurity. And we're introducing the latest operating system from Windows 10. And one important aspect that I would really like to emphasize are the several security measures that the system can offer, with hard disk encryption, with DICOM encryption, with secure transfer via Tricify, with a secure user management system, which all of those offer various mechanisms to secure the integrity of the system, as well as the patient data that is stored on the system. And cybersecurity, or measures against for cybersecurity, are continuously important to protect the integrity of your system. So it's really, in summary, BT21 is a very strong enhancement. It's the fastest and most powerful Voluson Expert series, with enhancements of the radiant system architecture, with imaging capabilities with such as shadow reduction, with a new probe with RM7C, which provides phenomenal image quality in obstetric ultrasound, expanding slow flow capabilities by offering 3D, enhancing fetal HQ with fetal cardiac analysis to evaluate the size, the shape, and the contractility of the fetal heart, and expand in the shared service market by offering and introducing the L8-18I probe for high-resolution near-field imaging in musculoskeletal, in small parts, as well as in pediatrics.
Voluson Expert BT21 is already creating waves globally. Let's take some time to understand what our first key customers have to say about this latest advancements on the BT21 series.
When 2020 was bidding us goodbye and 2021 was rolling in, we knew that Wuhan was still going to be with us. Corona would be there, Corona may go, but Corona will come back. And so we said, okay, technology comes to a standstill. But I was amazed, I was startled, I was fascinated, I was thrilled that someone somewhere and the engineers had been working to figure out that technology must keep taking leaps. I was truly startled when I saw the quality of the Voluson BT21. I didn't expect it. I didn't expect anything. And then I realized, wow, there is the good old radiant architecture, there is the radiant flow, but look at this. I mean, there is a richness in the quality of the image. And it's not just in the flow, it's in the grayscale, it's in the 3D. And I said, wow, these engineers have been working throughout Corona and bringing us this great technology that's going to take me with a huge big leap forward. And it's in 2D by the good old transducer, but even more excitingly by the new RM7C. And I cannot believe that something so light will give me so much more. And I'm using it for my routine work now. I'm being able to get all of this going just the way I would have liked it to be. When I see images like this, I said, wow, this used to be very nice. But now, look what I'm able to do with my standard grayscale for which I do for my 3D. Look how I can get slow flow. I mean, I didn't imagine that I'd be getting this kind of slow flow. The arborization, the great resolution that I see over here. And of course, the 3D appearance of the radiant flow. But apart from that, genuine actual 3D recording. And all of this was happening while Corona was raging. And when I saw the other functions, I said, wow, this is absolutely fascinating. We had sort of gotten used to the fact that we'd never be able to combine a great resolution of the C2-9 with a great 3D reconstruction of a volume transducer because we were so used to our old one, the 6C. And then we have the 7C. It's easy to hold in the hand. It weighs almost nothing compared to the older one. I now use it just all the time, so I can switch from one to the other. And I've been using the slow flow for the cranium, for instance. We've been using the grayscale for fascinating things like the face. We've been using great appreciation of fetal movement, resolution at depth, and all of this, which continues to be user-friendly. It didn't take me more than a day and a half to get used to the fact that, wow, this is what I was waiting for. Wow, what a leap. And of course, the gratitude. The slow flow that I'm showing here, and as we go on to moving that, even the very simple power Doppler that we see here is so fascinating. The resolution is so fascinating. At my standard 0.6 PRF, I'm actually picking up so many vessels that I never saw before. That's resolution for you. The ease of use, much simpler. More buttons? No. Shortcuts? Yes. And it's truly what I was waiting for. And I'm really looking forward to doing more work on this in the coming months and enjoying myself and also producing the best for my patients. Thank you, BT21, for arriving. Thank you very much.
Hi, I'm Dr. Chandar Lulla from RIA Clinic, Mumbai. I'm very excited to demonstrate our new latest acquisition from GE Voluson series, the Voluson E10 BT21 version, which we acquired in January of 2021. We have been using this machine since the last 6 months, and it has shown excellent 3D, 4D images over and above regular 2D images, both for women's healthcare and for general radiology. Our patients are highly benefited because we are providing more clinically useful information with this high resolution technology. The new technology is built on an innovative radiance system with new beam forming technology, and it has parallel processing power which is greatly enhanced. This provides multifold improvement in resolution due to the new software and hardware. The new transducers are the single crystal transducers, the C16, the C29, and of course the feather on the crown is the RM7C, which is the highly acclaimed new transducer, 3D transducer, which is very lightweight and is providing excellent images at great depth in the extreme high BMI images patients. Now you know that for a good 3D image you need excellent 2D images, and with this single crystal technology and especially the RM7C probe, which has excellent depth penetration and the focal zone is adjusted at a greater depth today. It provides images of with very high frame rate both in 2D and in color Doppler in the stick technology, and this allows us to see the fetal heart almost as if it is in real time. I'm extremely excited about the artificial intelligence technologies that has been incorporated in this machine. As you know, our AI is the new buzzword for imaging. We have Sono Biometry, Sono CNS, Sono VCAD and Sono ABC. All these features have been there from the previous versions, but you can see, I will show you a demo of the Sono VCAD, which has become very simple and very fast, and this can have two benefits. One is for the busy practitioner, you store the volume and immediately use Sono VCAD even at a later time, and this allows greater workflow, greater speed in your practice. And second, for the beginner who is not able to get all the views, this is greatly enhanced by the machine to get all the views automatically, and also highlights and gives us the different acquisition levels which are as per international guidelines by the AIUM in ISWA guidelines, all the different views. The color Doppler facilities on the BT21 version is stupendous. Here you can see radiant flow, which is much more enhanced than the previous versions. Radiant flow is truly radiant. It provides an almost 3D cast-like appearance to the flow which is actually in 2D. So it gives you a much better depth perception. We can pick up smaller color signals with greater definition. As you can see here, there is a small VSD here, and it allows the edges of the color signals to be sharply identified, very useful for pulmonary venous circulation, placental circulation, and to see small cardiac events in color like regurgitation, foramen ovale flow. As you can see here, it's very well identified. Being a radiologist, I use a lot of radiant flow in peripheral vascular imaging, and it's very exciting for me to see the peripheral veins and arteries with radiant flow. It allows me greater visualization and makes diagnosis in peripheral vascular Doppler much simpler. This is a very exciting color Doppler technique that has been developed on the BT21. It's called the slow flow imaging, or as I like to call it, microvascular imaging. One of the limitations of color Doppler was that we could not see flow in very small vessels. We could see vessels only up to the size of 125 microns, and with this slow flow imaging now we can see size of vessels almost 15 to 20 microns, and you can see here this is the first trimester fetus with the intersegmental intervertebral arteries so well imaged on aorta, arising from the aorta. I have never seen anything like this before in my last 30 years of using Doppler from 1990. The definition of these small vessels is greatly enhanced with slow flow imaging, and we are in an exciting era where we will be able to pick up neovascularity in tumors, in ovarian cancer at a much earlier stage of the disease. We are looking at perifollicular blood flow with slow flow. We can predict ovulation on the basis of enhanced flow seen around the follicle. In fetal imaging, you can see here very exciting to see vessels we have never seen before, like this here, the vertebral the intersegmental arteries, and we can pick up anomalous pulmonary venous drainage. We can look at placental circulation. It has exciting aspects there to look for placental insufficiency. The brain, fetal brain circulation, the pericallosal artery, the branches, and all this is going to provide greater diagnostic information in the coming days. Not only that, now with BT21 the same slow flow can be acquired in 3D, so we can have the entire volume information of 3D flow with slow flow imaging, and this is going to be especially useful in predicting neoplasia. We can actually measure the density of the slow flow vessels, the saturation index, the flow index, and we can look at perifollicular flow, and this is very, very exciting. Fetal heart functional analysis is the new exciting era of fetal echocardiography. We are extremely interested in looking at cardiac function in various pathological situations like growth restriction, twin transfusion syndrome, or any vascular malformation with volume overload, and in these situations we need to look at cardiac function very closely to predict deterioration of cardiac function, as this will allow us to better time our deliveries so that we have less fetal loss. To add to all the additional features that we have spoken about is one final feature is called shadow reduction. I think this is going to be and is already a very useful parameter for me, because there are areas hidden by bony ribs, the fetal skull, which does not allow us to visualize structures deeper to it, and with a complex algorithm which I am waiting to unravel myself and understand, they are able to get me images as though there is no bone existing overlying the structure. So if you see the image on the left is the fetal heart, it's shadowed a little bit due to the presence of the rib shadowing, and the edges are not appropriate. The moment I switch on shadow reduction, I can see all the margins of the fetal heart very, very well, although as though there is no rib overlying it. So this is very useful for any bony constrained area in the fetus, like the chest, even for looking at the cervix when the fetal, in the late third trimester, when the fetal head shadows the cervix and we can't see the cervix. This is an extremely exciting tool to see and enhance structures beyond bony shadows.
I'm Dr. H.S. Maan, practicing sonologist since 1987 in Jalandhar, Punjab. I started my practice in 1987 and started using ultrasound machines of various makes. I came across Voluson in year 2000, And since then, I'm deeply in love with this Voluson series, and I used many equipments since then. There is a lot of progress in ultrasound technology. Voluson has also come up a long way in improving the technology for the doctors, and in that series only we recently bought. So this machine is called Voluson E10 BT2021. So with this equipment, we are so happy that there were a lot of difficulties we were facing during day-to-day imaging, especially in obese patients, especially in the difficult patients, and the challenge of getting a abnormality scan little earlier now, like 11 week, 12 week, 13 weeks, and those challenges are now answered by this new equipment. As I talk about technology, there is a XD clear probes that has joined this armada now, and this one of them, the topmost is RM7C XD clear single crystal probe that has changed the entire scene. Earlier, the image quality used to be there, but not that crisp and sharp. And then the problem used to come with the color Doppler, especially in fetal heart, as the heart is very small until 18-20 weeks, but you have to go for an echo or something like that. So the delineation of various chambers was not that good. With the advent of this probe, now those areas are answered. And other two probes in this range is XD Clear probe C16C and C229. These probes are also amazing, and they also has a similar kind of resolution, and that has solved us the complete. This gives us a complete solution about obstetric imaging from 11 weeks to full-term pregnancy. Share another software in this new machine that is called shadow reduction. So with the shadow reduction, sometimes what happens is if the spine is anterior or bones are anterior, the organs behind those shadowing organs were not clear. We have a technology now in this new machine that if we press a button, it's called shadow reduction. The areas behind the shadow of those bones, they become crystal clear now. So this handicap is over now, and this new shadow reduction software is very good in a day-to-day practice, especially in fetal imaging. New probes with the Voluson E10 BT21. This is another probe which is called L818i. This is a hockey stick like probe with a very small footprint, and it gives excellent resolution for small part, especially I'm using for orbits, then thyroid. In pediatric, it has a very important role, especially in neonates. So this can give a very good resolution in abdomen, especially, and other parts like musculoskeletal, peripheral vascular also, carotid also. So this is an excellent probe which has a very good future, I think. I'm very thankful to the GE people for sharing this kind of technology with the users, especially me, and it gives me immense confidence now while scanning the patients.
Wow, that's amazing. The Voluson Expert Series BT21 will be available across 3 variants: the Voluson E6, the Voluson E8 and the Voluson E10. They will help set new imaging standards with advanced AI and smart applications. With the Voluson Expert Series BT21, we have also created a safe and secure ecosystem to safeguard your patients and the Voluson ultrasound systems, empowering your practices to remain current and secure throughout. With COVID-19, keeping your customers, patients and staff safe is a priority for us. Finally, easy access to the Voluson Club where you can view presentations and case studies from experts and learn tips and tricks of how to get the most of your Voluson system. All of these from a community which is dedicated for women's health ultrasound. Thank you so much for joining our launch event today and being part of our 20 years celebration of Voluson together. I would encourage you to visit, meet the experts section and get a glimpse of how these innovations are making a difference in daily clinical practice. Please enjoy the remainder of the program. Thank you so much and stay safe.